Dr. Hari, it's absolutely a pleasure to welcome you. And we from Starcare Hospital, we are equally excited to have you on our team. Doctor, we would be equally excited to know about yourself.
Yes, yeah. Well, I started my career a long way back as a greenhorn in the Indian Army, where I joined soon after my graduation in India from a medical college. And then I did my surgical training. It's called the Master of Surgery program in the Armed Forces Medical College in Pune, that's again in India. And I joined the Indian Army as a full-time surgeon. And I was there for close to 23 years, after which I took premature retirement and then went off to the UK for honing my skills. While I was still a surgeon in the Indian Army, I also went to the All India Institute of Medical Sciences, which you may know is a premier institute in India, for further training in specialized areas of surgery like Gastro Intestinal Surgery and Laparoscopic Surgery. In the early 1990s, laparoscopic surgery had just come into India, and I was one of the first people from the army to go for training in laparoscopic surgery. And then after having set up the laparoscopic program in the army hospitals, 3 of the major hospitals, for about 10 years, I went to the UK. And in 2010, I came to Oman to spend some time here in the private sector.
Doctor, as you rightly mentioned, you were actually expertise in UK, and you have did your education in UK as well. And after that, why is it that you have actually choose Oman as your future career prospective region? And why is it that you have actually choose Starcare as your best partner in association?
That's a good question. Well, I told you that I was in the army, right? And as a young man in the Indian Army, I came here on a deputation to this country in the 1980s. And I worked here for 3 years in the army here. And at that time I fell in love with this beautiful country. Of course, it has become even more beautiful now. So when I was in the UK and I got an offer to come and work here in the private sector, I was very keen to renew my relationships with Oman, and that's what brought me to Oman. After coming here and working initially in the private sector for some time, I discovered that I would love to associate myself with Starcare Hospital, because it was probably the first one in the private sector to be certified by a very, very important body from the USA called the Joint Commission International, which is a very, very important level of accreditation to certify that the hospital is of a very high quality. So I'm actually delighted to be now associated with Starcare.
We would definitely love to hear about your expertise in the surgical area. We would love to know about that.
Oh. Well, as I told you, I'm a general surgeon, but with a special interest in abdominal surgery or gastrointestinal surgery, and especially the laparoscopic side or the minimally invasive side of general surgery. As I told you, I trained in this many years back, and I went to the UK to further improve my skills and enjoy learning newer techniques. So basically my areas of interest are anything that has something to do with the abdominal organs, like gallbladder, like hernias, and of course related to the bleeding from the rectum, which is called hemorrhoids or bawasir in local language. And these are the main areas of interest. But essentially my overall interest is approaching any abdominal problem, surgical problem, in the laparoscopic way, because that is my main area of interest. I am also interested in problems related to excess weight. You know, obesity is a very common problem around the world, and I am particularly interested in management of obesity, both by endoscopic methods as well as by operative methods. I forgot to tell you earlier that I am also a trained endoscopist, in the sense I can do internal visualizations with equipment called endoscopes, and I can do this for diagnostic as well as treatment purposes.
Doctor, what are your common procedures, what you have actually seen till now?
Well, the common problems in my specialty or my area of interest are things like gallstones, stones in the gallbladder, which is under the liver in our abdomen. That's a very common condition, especially amongst women. The next very, very common condition that I see in my clinical practice is, as I told you earlier, bleeding from the rectum, which is most commonly due to hemorrhoids or piles or bawasir, as it is called in the Arabic language. The other common things are hernias, which are weaknesses in the abdominal wall, causing swellings in the groin or anywhere else. Then there are things related to excess weight, which cause people to become too heavy, and then they have a lot of problems related to their heart, their kidneys, their joints, and all that. So that is entirely huge but different group of conditions that I commonly see. In addition, I see emergencies like appendicitis, which is a very common problem in all age groups, and other emergency conditions like injuries of the abdomen and the rest of the body, plus swellings in the various parts of the body, which sometimes cause people to have pain. These are the common problems I see in my clinical practice.
Okay, I'm sure that food habits and what we generally have in Oman, it's generally one of the major concerns when you actually encounter your common cuisine.
Well, that's a very interesting point that you brought out. You know, we live in the world of fast foods, easy packaged foods, which are usually processed foods. So these have some negative effects on our system. What it does is it causes a lot of constipation, firstly. Secondly, in the absence of adequate exercise, the excess amount of calories that we take in through these fast food items causes us to put on too much weight because the energy is not spent by way of exercise or games and things which, as youngsters, the previous generations used to do. So basically, the problems related to food can be manifested in the form of constipation leading to bawasir or hemorrhoids, as I said, or excess oil in the food taken, which can lead to formation of stones in the gallbladder, among other conditions that contribute to it, and overweight situation, including young people, which is a very, very big issue we are being faced with. In addition, bad food habits and lack of exercise also makes people more prone to diabetes, which is not my area of specialty, but which affects my specialty because diabetes is a health condition that affects all of us in very many ways, and it is a very, very common and growing problem in Oman.
You use the term minimally invasive surgeries. Doctor, we would like to know more about it and its advantages as well.
Yes, sure. Yes, minimally invasive surgery is a very simple English term that means that you harm the patient as little as possible. You see, traditionally we've been brought up on the feeling that big surgeons make big incisions and big cuts. It was true to some extent in the past, but over time medical research made us realize that if you give too much of injury to a patient in the process of curing their condition, you are actually adding to their problems. If you have a big cut, patients do not breathe properly because of the pain and so on and so forth. They stay in hospital for a long time. They require more antibiotics and things like that. So, in the last few decades, there has been an explosion of development in video technology and instrumentation technology. All of this has been incorporated by us surgeons around the world to pass on this benefit to the patients in the form of what is known as minimally invasive surgery. For example, if there is a gallbladder to be removed from a person's tummy, in the olden days we used to give an incision that was this big, about 8 inches. Today we make only 3 or 4 very small cuts, none of them even half an inch in size or 1 centimeter in size, and we do the same operation. And the advantages of this procedure are that because the cuts are very small, the patients suffer less pain, they are able to go home earlier, they are able to get back to their work earlier. The hospital benefits because there are more beds available quicker for other patients to move in. There is also the benefit to the society at large that more people get treated in a shorter overall period of time. And by and large, everybody, including the society, the patient, the hospital and the surgeons, benefit from this kind of surgery. Well, yes, like any procedure or any methodology, it has got its good and it has got its negative points. But essentially, in the case of minimally invasive surgery, the main drawbacks are in the form of the cost of setting up a unit. Because these equipments are very costly, the hospitals have to invest a lot more money to set up a laparoscopic surgery unit. But the benefits are more than offset by the amount of money that has to be invested in the form of this, plus the cost that the patient pays extra because of the extra cost involved in overall management is offset by the fact that they get back to their work early and they are able to regain the expenses in a rapid fashion. The last thing is that most of us surgeons like to feel our tissues of the patients with our hands, because for a surgeon, his hands are as good as his eyes. In the case of laparoscopic surgery, we do not touch any of the patient's tissues. We use long instruments and we look at the video channel rather than at the patient when we are doing this surgery. So there is a little loss of that personal feeling and sensation in the surgeon's fingers, which is a bit of a drawback.
Doctor, you had mentioned about common incidents or common procedures what you have come across. But what would be your advice to these patients so that they are alarmed about it?
Well, we talked about conditions like gallstones, we talked about conditions like hemorrhoids or bleeding from the rectum, and we talked about obesity. These are the common things that I mentioned to you. The best advice that any doctor, including me, can give to patients is that they should look after their diet and not abuse their body. What do I mean by this? Eat what you feel like, but be a little sensible in what you take in, and do sufficient exercise to make sure that what you eat is utilized properly. For instance, if you eat a lot of oily foods and do not do exercises, your chances of putting on weight, your chance of having gallbladder stones, indeed your chance of having other conditions like cardiac conditions or high cholesterol are also high. So if you eat something like that, you have to make sure that you spend sufficient amount of energy in terms of activities. Finally, what one should also do is have a good amount of vegetables, fruits and high quality fiber and roughage in one's diet, so that our motions, our bowel motions are nice and normal, and this will to a large extent prevent people from getting very difficult conditions like hemorrhoids, which are not only embarrassing but can sometimes be very, very difficult to treat and keep on coming back.
Doctor, where do yourself and Starcare, do yourself see 5 years down the line?
Well, I'm very glad that you asked me where I see myself and Starcare Hospital together 5 years down the line. To begin with, I'm at a very big advantage that I have joined a hospital which has already established itself as the #1 healthcare provider in the city and in the country, and so it is easy for me to answer this question. I believe that in 5 years' time, I would like to contribute to the Starcare Hospital fraternity by taking it to the top level in terms of all minimally invasive surgical procedures which I talked about, especially driving towards the growing problem of excess weight in this country. As I mentioned to you earlier, this we hope to achieve by offering surgical services as well as endoscopic services such as intragastric balloon placement or placement of a balloon filled with water inside the tummy, so that you feel full all the time and therefore you do not eat much and therefore you end up losing weight. So 5 years down the line, I would really love to see Starcare Hospital offering all these services at a very high quality level, at the same time continuing to maintain our professed standards of giving high quality care at an affordable price, and to uphold our motto of keeping on caring for our patients.
Doctor, we would definitely would like to know about your personal as well as professional interests from our side as well.
But I believe in my heart that every doctor, surgeon or medical person has a duty towards the society. To that extent, I would like to sincerely pursue, and this is one of my heartfelt passions, public education in matters of health. There's a lot of information available in the Google and other aspects of the internet, as you are aware. And today, people have access to this information, but not necessarily are they in a position to understand and apply it where it is required. So, for the benefit of those, I would like to regularly carry out public health talks, that community health talks, so that we can educate the people about common conditions, preventive aspects of these common conditions, and how to seek appropriate help should they suffer from a particular disease condition. My other professional passions are education, in the form of educating young people, young doctors, in not only their professional aspects, which is of course important, but also in training them to be good doctors. And in my opinion, a good doctor first starts by being a good communicator. Once you are able to establish a good relationship with your patient in terms of listening to their complaints and listening to their problems in an empathetic way, you will be able to establish a wonderful rapport that will open up the channels of communication between the patient and the doctor. And this will be the first basis or foundation from which the doctor-patient relationship will grow to the benefit of the patient especially. The other areas of my interest in terms of profession are writing articles, which I regularly do in all the newspapers in terms of public health education, plus professional publications, making continuing medical education programs amenable to all the doctors so that we all grow together, because if we all grow together in interpersonal knowledge sharing, we will benefit the society overall at large.
Dr. We are absolutely thankful to you for sharing your vast expertise and knowledge to our informative session, and I'm sure we will have more interactions further, and I'm sure that everyone will be delighted to know more about yourself. Thank you, Dr. Hari. Thank you so much.
Thank you very much.